Welcome to the Deep Dive. Today, we're really pulling back the curtain on internal medicine. We're exploring it through a specific lens, some internal medicine doctor interview questions from Kaplan.
That's right. And our goal here isn't just about interview prep. It's more about, using these questions to understand what really drives doctors in this field. What's their mindset? What's their approach? We're looking at the questions and the thinking behind the suggested answers to get some real insight.
Exactly, kind of getting the inside track on what makes an internal medicine doctor tick.
Huh.
So let's just dive right in. The first thing that jumps out is the motivation. Why internal medicine? Why choose that specific path?
Yeah, and what's really telling is that it often attracts people who are just, fascinated by the human body. They see it as this incredibly complex, interconnected system. The source mentions fascination, but it's active. It's a desire to really dive deep, understand how all those different systems work together.
Unlike maybe focusing just on the heart or the kidneys,
Yeah.
they want the whole picture.
Precisely. It demands that kind of holistic view, that
Yeah.
inherent curiosity to figure out the puzzle. That's crucial for diagnosis, for management.
But it's not purely academic, is it? I mean, the desire to apply that knowledge seems really strong, too. The source talks about the reward in helping patients, manage chronic conditions and prevent future health issues.
Oh, absolutely. That connection is key. Internal medicine often deals with the long game, the sort of health marathon.
Mm-hmm.
Doctors build these long-term relationships, guiding patients through complex health journeys over years, sometimes decades. So the motivation isn't just the dramatic, acute stuff you might see on TV. It's often that consistent, thoughtful care that makes a huge difference over time.
Right, that steady hand. So, okay, that drive to understand the whole system. That must be critical when you're dealing with patients who have multiple chronic conditions.
Yeah.
How do they even start to tackle that complexity?
Well, the source really emphasizes a patient-first approach. It has to be collaborative.
Yeah.
The absolute starting point is prioritizing what the patient needs, what their goals are. Then it's about working with them to build a comprehensive plan, one that addresses all their conditions, not just one in isolation, seeing how everything connects the conditions, the treatments, the person's life.
And it's more than just managing multiple diseases, right?
Yeah.
It's about how the treatments themselves interact. The answer mentions thinking about potential interactions and side effects of different medications.
Yeah.
That sounds like a real juggling act.
It absolutely is. And also addressing lifestyle factors like diet and exercise.
Right. So it's not just pills.
No, definitely not. It requires some pretty sophisticated thinking, understanding pharmacology, how drugs influence each other, and bringing in diet, exercise that shows it's about empowering the patient too, giving them tools beyond just prescriptions.
And it's not a one-and-done plan either, is it? The source mentions regular follow-up and making adjustments.
Crucial. These plans have to evolve. People change, conditions change, life happens. So that ongoing review and tweaking is fundamental to making it work long term.
Yeah, got it. Okay, so managing complex patients is one thing, but the medical landscape itself is constantly changing. How do these doctors stay on top of everything? All the new research, new treatments?
It's a constant effort. The source outlines like a multi-layered strategy. The baseline is a commitment to lifelong learning. So regularly reading medical journals is foundational.
Just keeping up.
Exactly. But not just reading, critically evaluating the research, figuring out how it applies to their patients. Then you have things like attending conferences and continuing medical education, or CME courses.
Getting that direct input, interacting with colleagues.
Precisely. Learning from experts, but also sharing experiences with peers who are facing similar challenges. That interaction is key.
Which leads to the next point, right? This idea that it's not a solo mission. The source mentions consulting a network of colleagues for tough cases, being active in professional organizations.
Yeah, that collaboration is vital. Medicine, especially a field as broad as internal medicine, really thrives on that exchange. Getting a fresh perspective from a colleague can make all the difference. And professional organizations are like hubs, spreading best practices, sharing the latest breakthroughs.
So switching gears a bit to the practical side of things, electronic health records, EHRs, they're everywhere now.
Mm-hmm.
What does our source say about their role for these doctors?
The main takeaway is that being proficient with EHRs isn't really optional anymore. It's a core skill. The suggested answer mentions experience with a variety of EHR systems.
Okay.
And being comfortable with the basics, charting, ordering tests, prescribing medications electronically. These tools are woven into the daily workflow.
But it's got to be more than just technical skill, right? The answer also talks about understanding the importance of accurate records for continuity of care.
Absolutely critical, especially in internal medicine, where you're often managing long-term issues, maybe coordinating with specialists. EHRs aren't just digital files, they're the central point for coordinating care. Accurate, up-to-date records ensure everyone on the team is on the same page. That's essential for safe and effective care.
Makes sense. Okay, so the interview questions don't shy away from the tough stuff. They ask about handling difficult cases. The example given.
Yeah.
Wow. A patient with type 2 diabetes, hypertension, and heart failure.
Yeah, and on top of that, coexisting depression and issues with taking medication consistently. It's a really challenging scenario.
So how does the suggested approach tackle that?
Well, it immediately emphasizes empathy, taking the time to understand the patient's perspective, to address their concerns and fears. It acknowledges that health issues don't happen in a vacuum. There are often huge emotional and social factors involved.
Things that can really affect whether someone follows through with treatment.
Exactly. And the approach wasn't just the doctor working alone, it stressed collaboration with a multidisciplinary team.
Ah, bringing in others, like maybe a social worker, a mental health professional.
Could be, yeah. Building that comprehensive care plan together, it really highlights that it often takes a team.
And did the example mention an outcome?
It did, a positive one. It talked about improved health and reduced hospitalizations because of that regular follow-up and tweaking the plan. It really shows that even in these super complex, kind of overwhelming situations, that holistic, patient-focused approach can make a real difference.
That's encouraging. Okay, one last area the interview touched on, dealing with difficult patients, those challenging interactions. What strategies came up?
The core advice was about staying professional and trying to understand. Remaining calm and professional is number one. Also, actively listening to what the patient is actually saying, even if it's expressed in a difficult way.
Trying to see past the frustration.
Yeah, exactly. Trying to understand their perspective and figure out if there are underlying issues driving the behavior. It's like a problem-solving approach.
And building rapport seems important too, addressing your needs in a non-judgmental way.
Definitely. And the source ends on a practical note, suggesting that most difficult patients can be managed effectively.
So it's not hopeless.
Not at all. It suggests that with the right skills, patience, empathy, really trying to connect, you can navigate those challenges successfully. Better outcomes for everyone.
Wow. So wrapping up this deep dive, it's clear that being an internal medicine doctor is, well, it's incredibly multifaceted. It takes sharp analytical skills, to understand the body's complexity, but also that deep empathy, that patient-centered approach.
And the commitment to constant learning, staying current in a field that changes so fast.
Right. Plus the ability to handle these really complex health situations, often juggling multiple issues, collaborating with teams. It's demanding.
It really is. And when you think about just how complex our bodies are and the dedication it takes to understand and treat them, it kind of makes you reflect, doesn't it, on our own health, maybe how we interact with our doctors.
Yeah.
What does this deep dive make you, the listener, think about? About your own health journey, about the sheer knowledge and commitment involved in this field? What other questions does exploring internal medicine bring up for you? Something to think about.